Three of the most common questions I get from patients are related to nutrition, exercise, and sex. I'm going to try to talk about the what, when, where, and how of all those. Nutrition is important for fertility. It's important to get a balanced diet, to try to get a lot of protein in your diet as well as low carbohydrates. And it's important to get enough fruits and vegetables and have a balanced meal. It is not good to skip meals, and it's important to try to get snacks on board because that keeps the sugar at a constant level and it helps in your overall weight. It is important for fertility to keep the weight to a normal weight. Too high or too low of a weight can interfere with getting pregnant. And so it's very important for patients to try to strive towards their correct body mass index. In terms of exercise and nutrition go hand in hand. It's important to keep the exercise schedule that my patients usually keep. However, if there's procedures that happen, such as surgical procedures or where we retrieve eggs, we do tell patients to slow down in their exercise and to even avoid it for several weeks around the time of the pregnancy diagnosis. And in terms of exercise guidelines, it really is very individualized. It should be the same exercise routine that somebody's used to. And in terms of cardiovascular exercise, it is recommended that for patients undergoing IVF, that they should keep the cardiovascular exercise to less than 3 hours of cardiovascular exercise per week. In terms of sex and how often and when, in terms of patients trying to get pregnant, it's important to try to take infertility out of the bedroom. It's important to keep the same sex life as you normally do as a couple, but it is important to try to get some sperm deposited around the time of ovulation. So what I usually tell my patients is if they have irregular periods and regular ovulation times, to try to have sex every other day around the week of ovulation. And the day of ovulation, they should definitely have sex on that day and the following day. And otherwise, they should try to keep sex life to the usual couple frequency. They shouldn't try more or less than normal because that takes the fun out of it. And as much as couples can, I tell them to try to go on dates and remember other activities and not just sex. And to remember the foreplay and dating and seducing each other, which is important in the journey towards parenthood.